Good day, folks. Thank you for joining us here at Your Health. We have a very important program for you today. Today on Your Health, we want to talk about why you should be taking higher dose vitamin D. Turn on the recorder, tape this show, make a record of it, because we're going to provide you with a lot of information. It's hard to get it all in with just one viewing. You'll be able to play it again and learn more each time you watch the program, and share it with others. This is life-saving information. Vitamin D, that's today's topic. Stay tuned for that. But first, let's go to our news. Let's see what's happening in the health world. Feeling lonely is bad for the heart. Researchers from the University of Copenhagen evaluated over 13,000 subjects with various types of heart disease. They found feeling alone was a stronger predictor of poor health outcomes than living alone. Those who felt alone were at twice the risk of early death, regardless of the type of heart disease they suffered from. They also found they were 300% more likely to also have anxiety and depression. The study was presented at the annual meeting of the European Society of Cardiology. Well, this one's a real eye-opener. It also confirms the old saying that you can feel alone even in a crowd. Past studies have found living alone increased the risk of death, but this study went a step further, finding even those who live with others and possibly have a social network, yet they feel alone. These lonely souls are at twice the risk of death, no matter what type of heart disease they have, be it ischemic heart disease or angina, heart valve disease, arrhythmias, or even heart failure. All these suffer from increased risk of death. Plus, they are much more likely to also be stressed, anxious, and depressed. Folks, this is not just an issue for doctors and nurses. This is an issue for families, church congregations, husbands and wives. It's an issue for everyone that cares about their fellow humans. If you have a family member, friend, or loved one who has heart disease or any health condition for that matter, who is living alone, or they may be susceptible to feeling alone, please check in on them. Take them to church or out to dinner, or just sit with them for a time and be a friend. This simple act helps to reassure these lonely souls that they are not alone and someone cares. And perhaps most importantly, please understand, there are no medications for loneliness. Only the genuine concern and presence of others treats this far too common condition. The blue light emitted by digital devices damages the retina. The damage may then hasten the progression of macular degeneration and blindness. Past research has described this blue light-induced eye damage, and now researchers from the University of Toledo are the first to describe how blue light damages our eyes. They found the blue light emitted from the sun or from electronic devices causes the normally occurring vitamin A-like retinol molecule to change into a toxic substance. This initiates a chain of events that results in the death of critical photoreceptor cells in the retina. The damaged retina can no longer create a nerve impulse that would otherwise be perceived as normal vision. The researchers also report blue light damages all eyes. However, the degree of damage increases with age and declining health. The study was published by Scientific Reports. Well, this one's critical. Retinol is a form of vitamin A. Retinol is found in high concentrations in the back of the eye in the area known as the light-receiving retina. When a photon or light beam hits retinol in the retina, it initiates a chain of chemical and nerve reactions that eventually are perceived as vision. However, when blue light from the sun or an electronic device hits retinol, it not only is it perceived as the color blue, it also causes a chemical change in retinol that results in a toxic reaction that may kill vision-critical retina cells. Over time and with age and declining health, the blue light-induced eye damage may hasten the progression of macular degeneration, one of our leading causes of blindness. And the ever-increasing practice of using cell phones, computers, and electronic games that emit blue light is without a doubt causing eye damage to millions and blindness to thousands. Now, all is not lost. There are steps you can take to preserve your vision and still stay engaged with the modern world. The researchers recommend to first keep all of these electronic devices at arm's length or further. The further away, the less eye-damaging blue light reaches the sensitive retina. Next, do not use these devices in total darkness, as with darkness comes opening of the eye's pupil to collect even more blue light. Also wear amber-colored glasses or purchase electronic devices with blue light filters that cover the screen. And finally, be sure your daily multiple has at least 200 international units of vitamin E, and eat a colorful diet complete with a variety of antioxidants, as these agents have been proven to prevent blue light's retina-damaging effect. High-intensity blue light is not our friend, and we should all take steps to reduce our exposure. Well, today on Your Health, we'd like to discuss the health benefits of higher dose vitamin D. Stay tuned to learn more. Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient.
BioInnovations brings you Dr. Becker's Bionutrients Vitamin D3. And today, when you buy one bottle of vitamin D at the regular price, you'll receive a second bottle free. That's right, buy one and get one free.
Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
That's special once again. Today only, when you buy one bottle of vitamin D at the regular price, you'll receive a second one free. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128 or order online at bioinnovations.net. Ask about the auto ship program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. Are you one of the 25 million Americans who suffer from an autoimmune disease such as rheumatoid arthritis or lupus? Autoimmune diseases are caused by a misdirected immune system that attacks the patient as though their own cells are a foreign invader. You can manage the symptoms of an autoimmune disease by living a healthy lifestyle. Here's a strategy. Avoid unnecessary exposure to pollutants and chemicals. Eat a simple organic-based diet free of junk food, low in sugar and food additives. Avoid foods that seem to cause flare-ups of your disease, and stay active and exercise. Scientific research shows natural agents are of great benefit to the autoimmune disease patient. Yogurt helps to maintain normal bowel flora. Fish and flaxseed oil and noni juice calm inflammation. Vitamins and minerals provide nutrients for proper immune function. Keep fighting and don't ever give up. A positive attitude can make each day a little better. Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-pack. And remember, it's 50% off by the case.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the auto ship program for additional savings. That number's 888-442-2128.
Welcome back, everyone, and many blessings to all of you. I'm so glad you're with us today. Today's show is going to be quite an interesting one. We get to talk about the sunshine vitamin. You know, vitamin D. We've all learned about vitamin D. Now it's really a mainstream topic, so everyone's familiar with what it does for us. But do you know how much you really should be taking? We're going to learn about that today. This one's going to be great. So, Richard.
Yes.
Just because you take vitamin D doesn't necessarily mean you'll still have optimal health, because you may not be taking enough. Is that right?
That's true. That's true. For years, decades, scientists and physicians have assumed really all that vitamin D does is maintain our bone health. But what we've learned in the last 25 years shows that it does far more than just bone health. And that's really our topic for today. To attain good bone health, to prevent osteomalacia or rickets in a child, a level of 20 nanograms is enough to prevent that. But that is not enough to gain all the other benefits that vitamin D can provide us if we're taking enough. Well, what is this vitamin D stuff? It is a fat-soluble vitamin. that helps to control our body's calcium, magnesium, iron, phosphorus, and zinc levels and their deposition into bone and into tissues. It goes beyond just calcium. It's more than just calcium. But it also helps to control the growth of cells and regulates immunity, among many other things. Vitamin D is actually a hormone, and it should be thought of as a hormone. Now, you can take it in and ingest some in food, but the primary action is regulated by our bodies, and its action is more hormonal than vitamin-like. It's important to understand that vitamin D does not stimulate, initiate, or cause much of any actions. It enables. Does not stimulate, initiate, or cause, but rather it enables. Now, in our world today, when we think of enabler, that is someone who really isn't helping someone, like a spouse or a parent who enables their wife, husband, or child to abuse drugs. You're enabling, you're allowing him to use drugs. You are making his life easy so he can continue to use drugs. We've all heard this, correct? Well, think of that role in a positive way. Vitamin D does not stimulate the action, it doesn't initiate the action, it doesn't cause the action, but it makes it easier. What this means is, at a low vitamin D level, you're still going to have some immunity. You're going to have immunity, but is it enabled to the point where it prevents cancer or heart disease, or you survive the pneumonia? It enables you to survive. It makes your actions more efficient and more healthful. This is the essence now that we know about vitamin D. Am I getting that across? Because that's the key to the whole concept today. What else? The body can make vitamin D from sunlight, hence a hormonal action, and 7-dihydrocholesterol in the skin. Sunlight hits the 7-dihydrocholesterol. Hear that cholesterol? This is a good version of cholesterol that is converted into vitamin D. This dual function makes vitamin D physiology complex. We can ingest it or we can make it as a hormone. This complexity has the latest discovery and its full understanding and its role in good health. It has also led to a lot of misinformation. Dietary and self-made vitamin D is inactive. It must be processed by the liver and the kidney. No vitamins like that. No vitamin has to be activated. Hormones have to be activated into calcitriol or 1,25-dihydroxycholcalciferol. Most cells can activate vitamin D. Now, for decades, we've been taught and we felt that only the kidney can activate vitamin D into its active hormonal form or vitamin form, however you want to think of it. Neither one's incorrect. It's okay. But now we know virtually all cells can activate their own vitamin D. Also, virtually all cells in the body have vitamin D receptors. Now, let me ask you, if we only needed vitamin D for our bones, why would you have vitamin D receptors in your arteries and in your brain tissue? And why would your brain be able to activate vitamin D into its active form if it didn't need it for something? This notion that we have vestigial mechanisms that we no longer use, that's not scientific. That holds no water in the scientific world. So all cells can make vitamin D into its active form, and all cells have the receiver to take vitamin D and initiate a chemical reaction. This tells us, this is absolute proof that vitamin D has widespread use beyond just the bone. Widespread. Isn't that fascinating how they figured all this out? It's just amazing to me. Vitamin D2 is made by plants. The word starts with ergo. And vitamin D3 is made by animals. However, vitamin D3 is up to 87% more potent, and it by far and away has more research, and the experts recommend we should take vitamin D3. You can take D2, but you'll need to take more to achieve what your desired effect. Both D2 and D3 are converted to the active form of vitamin D. That's called 1,25-dihydroxycholcalciferol. We also call it calcitriol. We're just going to call the active form vitamin D. We don't want to complicate this with technical jargon. I do want to mention What do we ask for in a blood test? Doctors, nurses, and patients. You go into the doctor and say, I want my vitamin D level checked. That's 25-hydroxycholecalciferol, or 25-OHD. 25-OHD. That's our assay form. That's how we determine what your blood level is, and it's important to know that blood level. When vitamin D is made the natural way from sun exposure, our bodies regulate vitamin D. When we supplement vitamin D, we take over that control. So we need to know more about it. Are there toxicities? Are there bad things that can happen? Vitamin D receptor, important concept, binds active vitamin D, initiating gene expression or repression. So what vitamin D basically does, it turns on genes of wellness and turns off genes of disease. And remember, it does not stimulate, initiate, or cause, only enables normal mechanisms. We have wide distribution of this VDR, this vitamin D receptor, in the brain, in the nerves, in the bone marrow, where we make our white blood cells and red blood cells, in our muscles, intestinal tract, vascular tree, liver, heart, reproductive organs, hormonal system, and adipose tissues. In total, we now know that vitamin D affects the function of some 2,000 genes. 1 out of 10, about, we have 22,000 genes, give or take. Some 2,000 genes are affected by vitamin D. Now, what's the state of vitamin D in America? How's our levels? If we do studies, epidemiologic studies, what's the status? Are we sufficient, deficient? Where are we? Number of factors have created great confusion regarding vitamin D in health. Our dual function as both a vitamin and a hormone is very confusing to people. Differing units of measurements. You'll see international units. You'll see micrograms, nanograms, nanomoles. Oh, all the science. Who needs it? It's confusing. Ubiquity in both nature. You can get sun-induced. You can get diet forms. And we even have drugs now that are analogs to vitamin D. You take a shot of that, and it's supposed to last you all year or 6 months. There's a lot of confusion about what's best. Massive amount of data. You know, when you have 100,000 studies, original studies on a substance, and it's complicated, as we've alluded to, it's easier to believe there's no merit to that. No, you don't need to know anything about it. It doesn't do anything. That's so much easier. Now I can go off and do something else. But that is not the truth. That's what we call misinformation. That's not the truth about vitamin D. You need it, and it does remarkable things. There is undeniable evidence now that most are low, and the majority of these are so low they're frankly deficient. The vast majority of all humans around the planet are deficient in vitamin D. There's no doubt about this now. The controversy lies in whether we should supplement, not in whether we should supplement vitamin D, but how much should we supplement? The majority of negative studies that say you don't need vitamin D, they're too short in time. Remember, it only enables. It only enables. It takes time for vitamin D to do its work. The dose is too low. They start with an unknown amount of vitamin D in the bloodstream. They give a dose. They have no idea how high it raises it. Low doses barely raise vitamin D levels. This leads to further confusion. The Institute of Medicine says you only need 600 international units. Every expert agrees it's not enough. But we're going to straighten that up with more information when we return. Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient.
BioInnovations brings you Dr. Becker's Bionutrients Vitamin D3. And today, when you buy 1 bottle of vitamin D at the regular price, you'll receive a second bottle free. That's right, buy one and get one free.
Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
That's special once again. Today only, when you buy 1 bottle of vitamin D at the regular price, you'll receive a second one free. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128 or order online at bioinnovations.net. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. Do you have a family history of a certain disease? Scientists are discovering that our genetic code plays a smaller role than previously believed. Only about 20% of disease is tied to our innate genetic code. So what determines the other 80%? The answer may lie in the emerging field of epigenetics. What is it? Epigenetics is a group of changing factors responsible for both how our genes are read and how they are then applied throughout the rest of the body. And this may explain why identical twins with identical genes can have different health problems. Researchers believe two of the main factors in epigenetics are nutrition and environmental exposure to toxins. So eat a healthy diet, reduce toxin exposure, and you may improve your own epigenetics. For Your Health at a Glance, I'm Dr. Richard Becker.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastrodefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
We're back, everyone, having an amazing discussion on vitamin D. Richard, this is just amazing. I'll let you continue. This is so interesting.
Yes, people that we trust with giving us guidelines and how we should supplement our vitamins have said 600, 800 units a day, that's plenty. You don't need any more vitamin D. In fact, there was just a study released not too long ago that said any more than that, it doesn't make any difference. It's not true at all. Not true at all. The vitamin D experts, the impartial vitamin D experts who do not represent a drug company and do not sell vitamins, they all say you need between 3,000 to 8,000 units of vitamin D3 a day, and you may need more than 3,000 to 8,000 D3 a day if you're ill, overweight, or you're taking certain medications. What is vitamin D deficiency? This is another sort of source of confusion. When you get your lab tests back from the laboratory at the doctor's office, they will say that if your blood level is below 20, you're deficient, and if it's below 30, this is nanograms now, we're going to stay with nanograms, below 30, you're insufficient, it should be above 30. Well, the experts tell us it should be above 40, and personally, I believe it should be a 50 range. And I will give you reasons why I believe that. So what you're being told about where your vitamin D level should be is too low. Too low. Should be higher. Levels as low as 10 nanograms will prevent rickets and osteomalacia, but it will not protect you from our most common causes of death. But what about the ideal? This is the next question. Well, if we're trying to set where vitamin D should be set, that what our level should be, how about the ideal? A few years ago, a study was done on professional surfers residing in Hawaii. Now, they're out in the surf every day. They ride their boards virtually every day. They have sun exposure virtually every day. And they tested some 200 of these individuals, and they found their blood level of vitamin D was only 27. Well, let's look at the professional surfer of the day. And I've been there and I've observed these people. They put on wetsuits. They put on clothing, rash guards to protect their chest from the scratchy surface of the board, and they use sunscreen. They're not going to have an optimal vitamin D level when they do this. So another study was done recently on 2 different native tribesmen in the equatorial region of Africa. These folks never use sunscreen. They're out in the sun every day, and it's tropical sun, so it's intense. Every day you can make vitamin D in the tropics. Their vitamin D level averaged 46. This is the best information we have on to where our vitamin D level should be until we do precision studies on it. And those studies are being done and have been done. So 46. And I say move it up to 50 just to make it easy to remember. You want a blood level around 50 nanograms of vitamin D. But that's not where we are. We are far from that. Let's find out about that. Boston University, 82% of Americans are insufficient or deficient. 82%. 80% of nursing home residents, 70% of psychogeriatric patients. What is that? Alzheimer's patients. They don't get outdoors much. Unreliable intake of nutrients, very low in the Alzheimer's, dementia patients. 92% of children are low in vitamin D. A formula-fed infant, 32 ounces of formula only provides 400 international units of vitamin D. And remember, mother, when baby has 1 liter or 1 quart of formula, it's time to move on. So most babies on a bottle do not get 1 liter or a quart a day. They don't even get that much. That's not enough. If you have a dark complexion, you are low in vitamin D. 85% of senior African American women are low. 96% of sickle cell patients are tragically low in vitamin D. They don't get outdoors much. It's hard for them to do that. If you live in a northern latitude, and you don't have to be that far north, we're not just talking about Sweden. If you live north of the Atlanta-Los Angeles line, you are probably 4 out of 5 deficient in vitamin D, or at least suboptimal. 4 out of 5. The sun must be from 45 to 45 degrees in the sky for you to make vitamin D from the sun. UVB wavelength 295 nanograms is what's used by our skin to make vitamin D. This only occurs when the sun is from 45 to 45 degrees. Not one at sunrise, not at sunset, only 45. This never occurs in the Arctic regions, only seasonally in the temperate regions, and all year long in the tropical regions. Where do you live? The case is adding up. You're probably low in vitamin D. Those who wear sunscreen, work indoors, eat very little dairy, and by the way, you can't drink enough milk to get enough vitamin D. But it does count. It does count. It adds up. Those who have malabsorptive issues, and what I mean by that is you have chronic diarrhea, it's hard to absorb your D that you ingest, you're more likely. If you're overweight, you're more likely to have low D, and those with secondary hyperparathyroidism. If you're taking certain medications, you're probably low in D. Let's mention those steroids. Millions. How many millions of Americans are using steroids today? From inhalers for asthma to steroids to control chronic painful conditions, on and on, autoimmune disease, on and on. If you're in chemotherapy, you're low in D, I promise you. If you're taking barbiturates, phenytoin, or rifampin, or phenytoin, excuse me, barbiturates and phenytoin to control seizures, you're low in D. What happens at endpoint low vitamin D? Seizures, then death. How many people have seizure disorder? They're taking anti-seizure medicine. They've depleted their D so much that they have to add a second and third drug to control their seizures, when really what they need is vitamin D. This is the type of thing that keeps me awake at night. I'm concerned about that. We need to get this out to the people. If you are on seizure medicine, please get your vitamin D level checked and take the proper dose. Rifampin, isoniazid, these are tuberculosis drugs. And TB doesn't get well with low vitamin D levels. This is one of the oldest known treatments for tuberculosis is sun exposure. Imagine that, trying to conquer TB with insufficient, deficient vitamin D levels. And the drugs you're taking, the antibiotic to treat tuberculosis, is lowering your vitamin D level even worse. Cholestyramine, cholesterol, mineral oil, Olestat. The best thing to do is just ask your pharmacist if you're on more than a couple medicines. Do any of my medicines affect my vitamin D level? Please let me know, because I need to have this figured out. Good idea. But isn't there a point of too much vitamin D? We've been told this for decades. Oh, that's a toxic vitamin. You can overdo it. Well, this is something else. The level must be much higher than you thought. A Mayo Clinic review, 17,000 subjects taking up to 20,000 units of D a day, no toxicity. Toxicity requires, they concluded, from 50,000 to 1 million international units a day for months to years before toxicity develops. Another study of 20,000, only one subject with blood levels over 360 had any evidence of toxicity. Out of 20,000 users, 3-4 times the level of what we're being told before there's any toxicity. Isn't that amazing? We have more on D when we return. Stay tuned. Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient.
BioInnovations brings you Dr. Becker's BioNutrients Vitamin D3. And today, when you buy one bottle of vitamin D at the regular price, you'll receive a second bottle free. That's right, buy one and get one free.
Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
That's special once again. Today only, when you buy one bottle of vitamin D at the regular price, you'll receive a second one free. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128 or order online at bioinnovations.net. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker, and this is Your Health at a Glance. Do you suffer from cramps, gas, bloating, or other digestive troubles? How about fatigue, depression, and headaches? All these symptoms could be caused by a condition called lactose intolerance. Your body doesn't digest lactose, the sugar found in milk and other dairy products. As a result, you can suffer from a wide variety of symptoms. If you often experience digestive problems, fatigue, depression, or headaches following meals, try avoiding dairy for a week or two and see if your symptoms lessen or go away. All of the nutrients found in dairy, including calcium, are present in sufficient amounts in other foods. So if you find that you are lactose intolerant, you can safely avoid dairy and still enjoy complete nutrition. For Your Health at a Glance, I'm Dr. Richard Becker. Have you heard about the health-promoting power of medicinal mushrooms? These remarkable mushrooms include maitake, shiitake, reishi, and ABM. The medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems.
BioInnovations brings you Dr. Becker's BioNutrients Mushroom Complex with maitake, shiitake, reishi, and ABM in one convenient product.
Our mushroom complex features the safest and most powerful medicinal mushrooms available, providing natural support for a variety of health conditions.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Ask about the AutoShip program for additional savings.
We're back, everyone, learning about how important vitamin D is for our optimal health. So to help you get it, we have the great special, I know the one that you love. Buy one, get one free today on the Dr. Becker's BioNutrients Vitamin D3. This one is already converted for you, the great form Vitamin D3. That's the one you want to get. So Richard, now we're going to talk about the role that low D what happens to us when we're low?
Yes. Well, according to researchers in Great Britain, when vitamin D is insufficient, it raises all-cause mortality by 75%. In other words, you're 75% more likely to die this year if your level's below 30. 75%, that's astounding. Boston University, vitamin D significantly affects some 2,000 genes, and when that's not working right, when it's low, you open the door to a wide variety of diseases. Of the 19 of the 30 leading causes of death in the United States, 19 of the 30 are related to low vitamin D. 336,000 deaths a year in the United States alone at a cost of $130 billion, and that's money 5 years ago. So $150 billion a year. How can we have a healthcare system that is affordable when we're not properly nourished? How can that happen? Don't wait for your politicians to figure this out, folks. It's up to you. Don't wait for your doctors to figure it out. Their business is disease, not wellness. $150 billion a year. That's amazing. What else? Cancer support. Norwegian researchers, when you're low in D, 63%, well, excuse me, when you're high in D, when you're above 32, more positive. When you're adequate vitamin D, 63% more likely to survive breast cancer, 60% more likely to survive colorectal cancer, 67% more likely to survive leukemia and lymphomas, 81% more likely to survive lung cancer, 76% more likely to survive prostate cancer. Canadian study. A 32 level or above reduced head and neck cancer deaths by 15%. British study, an 8-point vitamin D increase, every 8 points reduced your risk of melanoma by 17%. And what do they tell us? Stay out of the sun. You don't want melanoma. Well, get a little more sun, don't burn, and raise your vitamin D level and lower your melanoma risk. Vitamin D also lowers cancer risk. Typical U.S. breast cancer patient has a level of 17. That's tragically low. 70% of breast cancer patients have low D levels. Vitamin D insufficiency tied to a 250% increased breast cancer risk. Now, these are association studies. They do not prove cause, but when you understand how vitamin D works and the preponderance of evidence, you come to firm conclusions. It's like a circumstantial case in a court of law. Eventually, you don't need the DNA to know for sure he did it. You see what I'm saying? Preponderance of evidence. And we can't really use drug methods, drug investigational statistical methods to investigate vitamins and hormones, because we can't set up a control group that gets no vitamin D. No vitamin D at all. That would be barbaric, inhumane, and torturous to those, because we know they will be ultimate demise. So you can't just set up double-blind studies to prove vitamin D. I really have to help you understand that. And when you set up a vitamin D study with double-blind methods, you're actually conducting unscientific methods. And you would only do that to mislead people. Okay. What else? Vitamin D lowers the muscle and joint pain during chemotherapy for breast cancer, and you're 60% more likely to be alive in 5 years if you take a little extra vitamin D during breast cancer. Colorectal cancers. Deficiency suppresses the release of immune proteins that stop the growth of colon cancer. A typical colon cancer patient is low in D, and it increases their risk of death by some 37%. Lung cancer. Up to 80% improved survival when vitamin D is up to that 45-50 level. Denmark, low vitamin D levels tied to significantly higher risk of tobacco-related cancers and tobacco-related cancer death. Well, tobacco smokers need more vitamin D because of the high inflammatory state. You use more. So in certain settings, you have to take a little more than the average person. Lymphoma and leukemias, deficiency tied to a 40% higher mortality rate for large B cell. Low D doubles your risk of leukemia. Low D doubles your risk of leukemia. Chronic lymphocytic leukemia with vitamin D deficiency, 2 times the risk of rapid disease progression and death. And it'll only cost you 20 cents a day, maybe 30 cents a day to take vitamin D. And some of these cancer treatments, which we need, I'm not saying we don't, cost thousands, hundreds of thousands even. And this tiny little pill so cheap, can do so much, and they won't even accept it. It just amazes me. Prostate, those with high vitamin D levels are 57% less likely to develop fatal prostate cancer. It stalls the progression of the lower aggressive type prostate cancers. So many men are diagnosed with prostate cancer, and it's a very slowly progressive disease. If you take vitamin D in that setting, it stalls. 2/3 of the patients stall that progression of prostate cancer. But you got to get your level up to that 50 or more. Pediatric cancers. About half the kids that present with pediatric cancer are tragically low in vitamin D. Skin cancer. Those who avoid the sun, they also avoid skin cancer, but they are 3 times more likely to develop cancers internally. Why would that be? Well, it's vitamin D helps us fight cancer. Yeah, we're not getting the UV damage to our skin. We're avoiding skin cancer, but we're also much more likely to get internal cancers. Finnish researchers said if we doubled our sun exposure, we would save 10 times the number of lives that we would lose to skin cancer by preventing internal cancers. If you're going to have cancer, get it on the skin where you can see it and do something about it before it spreads. We have more in just a minute. Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient.
BioInnovations brings you Dr. Becker's Bionutrients Vitamin D3. And today, when you buy 1 bottle of vitamin D at the regular price, you'll receive a second bottle free. That's right, buy 1 and get 1 free.
Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
That's special once again. Today only, when you buy 1 bottle of vitamin D at the regular price, you'll receive a second one free. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128 or order online at bioinnovations.net. Ask about the AutoShip program for additional savings.
Here is our hope for you today. I'm Cindy Becker. When we struggle with disease and painful health conditions, we can become overwhelmed with negative thoughts. We may even develop depression. The Apostle Paul offered guidelines to help us preserve a positive attitude during times of trouble. He wrote in Philippians 4, verse 8, "Whatever is true, whatever is noble, whatever is right, whatever is admirable, if anything is excellent or praiseworthy, think about such things." Thinking positive thoughts is the first step toward overcoming worry, even depression. Proverbs 17, verse 22 reminds us, "A cheerful heart is good medicine, but a crushed spirit dries up the bones." Remember these words of wisdom as you face your health challenges. I'm Cindy Becker. This is our hope for you today.
Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
So what can we do to get back in balance? We can eat a healthy diet.
And most of us need to supplement with omega-3 rich fish oil. Fish oil contains omega-3s with DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan and boost omega-3 to get back in balance.
To help you do that, BioInnovations offers 2 products, the Fish Oil Complex and Omega 369, both formulated for your health and well-being. So how do you choose? For highest levels of DHA and EPA, choose the Fish Oil Complex. For a balanced formula, choose the 369.
Go online at bioinnovations.net or call 888-442-2128. Ask about the AutoShip program for additional savings.
We're back, everyone. I just want to tell you a little bit more about our special today. I want to help you get that vitamin D you need, so that Dr. Becker's Bionutrients Vitamin D3 is buy one, get one free. Buy one bottle at the regular price, you'll get a second bottle free. Fantastic value. And Richard, there's something like 200 capsules in that little gel caps in there, so that's quite a bit.
Also, a very important thing is the 1,000 International Unit D3 allows you the liberty of setting your dose.
Right.
So you can custom fit your dose. Now, we're talking about vitamin D and its varied actions. The immune function, we have so much information. I have to accelerate a little bit because we definitely want to cover how much to take. And we want to cover that very thoroughly. Vitamin D helps to control our immune function. What does it do? It is involved in immune activation. So when you contract a pathogen, you want your immune system to kick into gear quick. Vitamin D helps that to happen. It helps to control autoimmunity. I don't want my immune system to attack my joints like in rheumatoid, or my nervous system like with MS. Vitamin D controls autoimmunity. It also helps to control allergies, asthma, and eczema. I want my immune system to not react to pollen or house dust as though it were a pathogen like TB that would infect me. Inappropriate reaction to something. Vitamin D is involved with that. It also helps to help cells so they don't continuously grow. Cancer prevention. It helps to initiate apoptosis, program cell death. That's a normal thing. It also helps to create the right immune response for the right problem. For example, let's say I contract strep throat and my immune system confuses the strep germ with my heart valves. That's called rheumatic heart disease. I don't want that to happen. Vitamin D helps to prevent that phenomena. This is so effective. In vitamin D, appropriate vitamin D levels is so effective in controlling a proper immune system. A study showed that if you have a 38 level of vitamin D or above, you're 60% less likely to have upper respiratory infections, 60% fewer upper respiratory infections, and 80% fewer sick days. It's that effective. Isn't that amazing? When we have a deficiency in D, it causes a misdirected killer T cells. And what this does is it turns on our immune system to attack us. Multiple sclerosis, inflammatory bowel disease, rheumatoid arthritis, insulin-dependent diabetes, and the inflammation of diabetes type 2. Half of all rheumatic disease patients are tragically low in vitamin. When I say tragically, it's below 20. Half of them. European Journal, 4,000 a day improves T regulatory cells. It's a certain type of lymphocyte countering autoimmunity. And we now know if you have MS and you take higher doses of vitamin D, it will modify the course of your MS. It is now considered a therapeutic agent in MS. But remember, vitamin D deficiency is not the cause of MS. Remember, it does not stimulate, initiate, or cause, only enables. So you can only have the best immune system that you can have if you're sufficiently up with your vitamin D. See, this is clarifying the role of vitamin D. We have so much new good knowledge on vitamin D. Let's see. Let's talk about cardiovascular disease. Deficiency in vitamin D leads to stiffer arteries, clogged arteries, poor vascular function, higher cholesterol levels, 40% more likely to have angina, 60% more likely to have a heart attack, 66% more likely to have high blood pressure, and it is the salt-sensitive type. Salt-sensitive. 64% higher risk of peripheral artery disease, clogged arteries out in your arms and your legs. 64% more likely to have pain when you take a statin drug to lower your cholesterol. You know, so many people, they take the Lipitor type class and they go, oh, I just ache all over, but doctor says I have to have it. Get on your CoQ10, get on your vitamin D, and it's going to get better. It may not get better enough that you can keep taking it, but you won't know until you try it. Vitamin D and CoQ10 helps with the muscle ache of the Lipitor class. You are 81% more likely to have a fatal heart attack if you do not have enough D, and 300% more likely to have postmenopausal hypertension. All of these things are known risk factors for cardiovascular disease. And I saw a study recently, well, we gave 2,000 units to the patients with hypertension, and we never checked their blood levels, and 2,000 only puts you at about a 25 blood level. 2,000 equals about 25, and that's it. And after 3 months, their blood pressure wasn't any better, and so the conclusion, the headline of the study was, vitamin D plays no role in hypertension. Lie, not true. You've got to get it up to that 48, that ideal that the tribes in tropical Africa have, then it does. And I promise you, it does. If it's not lowering your pressure enough at that dose, something else is also going on. There are other things that can make you sick too, right? What else? Oh, I do want to say this. Dr. Leslie Ray Matthews, trauma surgeon extraordinaire, he's a remarkable man, trained at Mayo Clinic. He is affiliated with the Morehouse University in Atlanta and the Grady hospital system there. He is the head of trauma surgery, and his whole department, they're remarkable people. He did a study where he compared 50,000 units. These are people who have been in car wrecks, they've been shot, they've had chainsaws run through their legs, severe trauma. These people are on death's door. He did a study, 50,000 a week to these people, or 50,000 vitamin D every day. Now, most would say that 50,000 a week is plenty. You don't need any more than that. You're going to make them toxic. He gave them 50,000 every day. And what he found was the heart attack rate went from 22 to 11. Half the rate of heart attack at the high dose. Hospital stay went from 36 days to 8 days, a fourth the amount of time in the hospital. And the cost of their care went from $140,000 to $32,000. This is the type of savings we're talking about from high dose in acute trauma, life-threatening trauma. Who would ever think that? So when the body is under extreme stress, we can use huge amounts of vitamin D. And if we're just giving them 2,000 a day, you're never going to see that effect, are you? But Dr. Matthews did, because he had faith. What a bold man. I'm so proud of him. He's been on this program. We have a break. We'll be back, folks. Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient.
BioInnovations brings you Dr. Becker's BioNutrients Vitamin D3. And today, when you buy one bottle of vitamin D at the regular price, you'll receive a second bottle free. That's right, buy one and get one free.
Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
That's special once again. Today only, when you buy one bottle of vitamin D at the regular price, you'll receive a second one free. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128 or order online at bioinnovations.net. Ask about the auto ship program for additional savings.
I'm Cindy Becker, and this is Your Health at a Glance. Did you know the typical baby born in America today has over 200 foreign chemicals in their bloodstream? The world is a polluted place, but just how polluted may come as a surprise. Health experts report that pollution plays a major role in the development of ADHD, obesity, cardiovascular disease, Parkinson's disease, ALS, and a wide variety of cancers, including prostate and breast cancer. There are safe and simple steps you can take to lower your exposure to chemicals. Eat an organic, pesticide-free diet whenever possible. Be careful with the home use of chemicals. Don't consume fish that may be contaminated with mercury. Have your water supply tested for purity and add houseplants to lower indoor pollution levels. By taking a few basic steps, we can protect ourselves from disease-causing pollution. For Your Health at a Glance, I'm Cindy Becker.
Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why BioInnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Again, that number is 888-442-2128. Call today. Ask about the AutoShip program for additional savings. Your Health is brought to you by BioInnovations, trusted products for your health and well-being.
We're back, everyone. This hour is just flying by, isn't it? I want to just give you a quick reminder on the vitamin D special. Buy one, get one free today. Don't miss it. Richard, time is so short, and I know you have more to highlight.
Some highlights. If you're in chronic pain, musculoskeletal pain, you are most probably low in D. Get your level up. It's going to help your chronic pain. If you have any orthopedic surgery coming up, please be on the vitamin D at the higher dose. Mothers require a blood level of 48 nanograms to provide growing baby in the womb with optimal vitamin D levels. The only way you're going to know if you're at 48 nanograms is to have it tested. And it's going to take more than that prenatal vitamin. It's going to take more than that to get to 48, and it's safe. It's for baby's welfare. Diabetes. Over time, as you take the higher dose of diabetes, your measures of blood glucose control will improve. Your inflammation levels will drop. Your blood pressure will drop. Your glucose will drop. Your cholesterol will drop. All these things that we're striving so hard to attain in diabetes control will become easier for you. Other common effects. Gingivitis. That's low D. Dysmenorrhea, endometriosis, difficult menopause, polycystic ovarian syndrome disease, whatever you want to call it. This is all vitamin D related. Please get on it for reproductive problems. Better toxicity clearance, and on and on. Now, how do we take this stuff? This is really very important. And now you see why I asked you to record the program. There's so much information. If you are in the swimming suit and you are out in the sun until you're pink, you have just made 10 to 25,000 international units. If you're out in the sun every day and you're not wearing clothing or sunscreen, you are making 20,000 a day, and Mayo Clinic found that 20,000 a day is okay to do. You can take that long term for most people without toxicity. 1,000 units a day barely raises your level. 2,000 a day only gets you to 25-ish. That's not enough. 4,000 a day leads to 34 to 40 for the majority, but that may not be enough. 4,000 to 8,000 units of vitamin D3 a day is my recommendation to you, depending on your size, your obesity level, and what medicines you are taking. The only way to know for sure if you're taking enough is to have your level tested. Do not take vitamin D once a month and assume that's all you need to do. We know the last 2 weeks of that month you will have low levels and you'll be unprotected. And going high, low is the worst way to do things. You want a steady level of around 50 nanograms per deciliter. If you have trauma, bump it up. If you develop pneumonia, bump it up. And by the way, the vitamin D is better protection against the flu, seniors and children, than your flu shot. It's better. They're not telling you that, are they? But you heard it here because you matter to us. The truth matters here at Your Health. Well, Cindy, I hope I did a good enough job. There's so much to learn. We ought to make it 2 parts. Thank you for your kind attention, folks. We'll see you here tomorrow. Bye-bye.
Thanks, everyone. We'll see you tomorrow. Bye-bye.
Live under the protection of God Most High and stay in the shadow of God All-Powerful. Then you will say to the Lord, "You are my fortress, my place of safety. You are my God, and I trust you." The Lord will keep you safe from secret traps and deadly diseases. He will spread his wings over you and keep you secure. His faithfulness is like a shield or a city wall. You won't need to worry about dangers at night or arrows during the day. And you won't fear diseases that strike in the dark or sudden disaster at noon. You will not be harmed, though thousands fall all around you. And with your own eyes you will see the punishment of the wicked. The Lord Most High is your fortress. Run to him for safety, and no terrible disasters will strike you or your home. God will command his angels